Your Dog's Friend is a nonprofit 501c3 whose mission is to help keep dogs out of shelters by educating and supporting their humans. We promote positive method of training and behavior modification through stress-free methods. As part of that mission, we offer free webinars like the one you're about to watch. Subjects range from dog behavior, stress-free training, and other tools to help you understand your relationship with your dog. If you like the webinar, be sure to give us a thumbs up. Click the notification bell and subscribe to our channel. By subscribing, you'll be notified when future videos are posted. Now enjoy the webinar.
Hello, everyone. Welcome to our webinar today on health and behavior. We are fortunate to have our speaker, Dr. Amy Learn. Dr. Learn is the Chief of Clinical Behavioral Medicine at the Animal Behavior Wellness Center's Richmond, Virginia branch. She was in general practice until 2017 when she began a residency in clinical behavior medicine. Dr. Learn has contributed to veterinary textbook chapters and journal articles, and she received the prestigious R.K. Anderson Resident Achievement Award from the American College of Veterinary Behaviorists for outstanding research in the field of applied animal behavior. As usual, for those of you who haven't been with us before, though, put your questions in chat. We will get to them at the end. We will get to as many as possible. And also, I want to remind you that Your Dog's Friend is a nonprofit, and we are able to bring you these webinars and other of our free services because of donations. So if you're inclined either during or after the webinar, we have a donations icon that you can use on our homepage at yourdogsfriend.org. I'm sure that we will all learn a lot today from what Dr. Learn has to say, and I think she's ready. It's all yours, Dr. Learn.
Thank you so much. I'm excited to be here, and it's really hot where I am, so it's nice to be inside, and hopefully you can all be enjoying some cool weather inside through this lecture as well. So many people consider the mind and the body separate entities, but there's a growing body of evidence that supports just how intertwined they are. In today's lecture, we're going to discuss a bit about the brain and how it interacts with the body and how systemic illness can affect behavior. And just like Deborah said, I ask that you hold your questions until the end. We'll have plenty of time to cover everything. So I know that Deborah gave you a little introduction about me. I graduated from the University of Pennsylvania. I've been a veterinarian for 20 years. I'm a wife, a mother, a pet parent. You can see a picture of Forrest and Marshall on the screen in front of you. I have some chickens and a bearded dragon. I'm the Chief of Clinical Behavioral Medicine at the Richmond office of the Animal Behavior Wellness Center. And that's where my practice is limited to assessing and treating behavior problems in companion animals. I've also spent time working with several species of wolves, coatimundis, and chimpanzees. So behavior is the range of actions and mannerisms made by individuals, organisms, systems, or artificial entities within some environment. It is the computed response of the system or organism to various stimuli or inputs, whether internal or external, conscious or subconscious, overt, covert, voluntary, or involuntary. Now that is a very wordy and boring definition. It is important to recognize that behavior essentially is a choice that an individual makes to solve a problem. There's always a function for that behavior. This lecture will cover how the brain processes information and how the body's health affects the brain's function and therefore behavior. We will take a look at the gastrointestinal system, the dermatologic system, neurologic system, and an overview of pain processing. So let us start by defining what behavior is or how it forms, and then relate that to the brain's control of behavior. As you can see, everything happens in life, even before birth, affects behavior. I know that this is a busy slide, but I want to list the main categories represented by the circles here. That's genetics and development, learning experience, health, as well as the current situation. Instead of what is behavior or what causes behavior, a better question might be, where does behavior come from? This dog's brain is focused on important topics like food, walks, sticks, and riding in the car. The way the brain processes information directly affects behavior, and the health of the body affects that brain's function. There's a complex connection between behavioral medicine and systemic conditions. This connection can take many forms, including neurotransmitter or chemical communication, nervous system pathways, and even messages sent via the bloodstream. Whoops, I must click that twice. This slide gets into the really technical aspects of behavior, so I will make it as simple as possible. This is a more anatomically correct picture than the dog's brain that we just looked at. And though it may just look like a mess of color and lines, each section plays a distinct role in behavior. The functions can be broken down into receiving sensory information, conscious perception or awareness of that information, formation of a plan, motivation to act, and the motor response to carry out that action. In this graphic, we see the prefrontal cortex, which is way up here. Oh, there's my cursor, way up here. And that's responsible for decision making. Then we have the hypothalamus, which comes down here. And that keeps the body's functions balanced. The limbic system, which is really represented down, where's my cursor? Down here by the amygdala. And that controls motivation, memory, emotion, reward systems. It also outlines where the majority of sensory input and motor output are centered. So I want you to think about the brain as the main switchboard that controls the body. It communicates internally, coordinating with other parts of the brain, as well as externally, sending and receiving status reports to other parts of the body. So thank you for bearing with me through that really difficult information. And now that we've shed some light on how the brain functions, we can focus more exciting things like the pathways that lead to and from the brain and how the body's health affects those pathways. This intersection shows that all the roads converge on one central circle, just like all of the body's systems send information to the brain. So we will move on to other body parts and how they function in relation to affecting behavior. Those systems include the gut, the skin, and the nervous system. So this first body system that we'll tackle is the gastrointestinal system. It is in charge of digesting food, allowing nutrients to be absorbed into the body to create energy, and then excreting that remainder as waste. This seems like a simple concept, but lots of things can go wrong. This graphic is overly simplified, but it shows the main parts of the gastrointestinal system, including the esophagus, the stomach, the small intestine, and the colon or large intestine. So let's take a look inside. The word microbiome is a term that encompasses all of the microorganisms that colonize the lining of the gastrointestinal tract. And even though we talk mostly about the different types of bacteria that are there, these organisms are also viruses, protozoa, and fungi. A healthy microbiome can be negatively affected by illness, stress, age, diet or change of diet, and medications, especially antibiotics. When that happens, the result is dysfunction, which is an alteration in the composition of the gut microbiota that results in functional changes. The local effects of this dysfunction are acute diarrhea, sometimes even bloody, malabsorption of nutrients, or inflammatory bowel disease. One study showed that a single course of antibiotics in an animal affected that animal's microbiome for 3 more months. So we want to be really careful about how everything affects our body systems. Aside from local effects, the microbiome also has far-reaching systemic effects. It contributes to metabolic functions, protects against pathogens, educates the immune system, and affects most of our physiologic functions. A healthy and stable microbiome can simultaneously act in pro and anti-inflammatory ways, keeping a balance to prevent excessive inflammation while still being able to promptly respond to illness and infection. You can see that the microbiome can directly affect the immune system, skin and coat health, weight control, kidney and heart function, lifespan, heart and brain function. Those are some really big jobs for some tiny little organisms. So I just told you all the cool things the gut microbes do to help the body. Now I want to tell you how they affect the brain. Mounting evidence suggests that gut microbes help to shape normal brain cell development, biochemistry, and behavior. In particular, these little guys are important communicators between the gut and the brain. Now, the majority of serotonin found in the body is in the intestinal tract, and I mean almost 98%. Serotonin is the main mood stabilizing neurotransmitter in the body. The fact that most of it is in the intestinal tract has led to the development of the gut-brain axis concept. There are several different pathways that the microbes use to communicate with the brain and central nervous system, including the enteric nervous system, the sympathetic nervous system, the hypothalamic pituitary adrenal axis, immune signaling, and gut bacterial metabolites. Now, I want to explain each of these a little bit more in detail. So the enteric nervous system, sometimes called the second brain, is made up of hundreds of millions of neurons that extend along the length of the digestive tract. This system communicates subtle changes within the gastrointestinal tract to the brain. The sympathetic nervous system controls the behavioral responses of flight, fight, freeze, or fidget. The release of adrenaline from the brain and adrenal glands can also alter how the food you are digesting moves through the intestinal tract. The hypothalamic pituitary adrenal axis mediates the secretion of cortisol, which is a hormone. Cortisol influences the immediate stress response, and research has shown that gut microbes may affect the development of systems that govern the hormonal response to stress. Immune signaling can affect immune cells located in the gut lining that modify activity of the cells that sense changes in the gut. These immune cells release chemicals to respond to inflammation and infection, keep our bodies healthy. Gut bacterial metabolites are byproducts of fermentation and metabolism of indigestible fiber, or prebiotics, by the gut microbe. They are short-chain fatty acids, which are particularly important for brain function. Additionally, the gastrointestinal tract and its bacteria contribute to the body's production of hormones and neurotransmitters, including dopamine and serotonin. So why is any of this really important? Stress can really affect the GI tract. Think about when you were in school and it was time to take an exam. You might not have even been able to eat breakfast that morning because your stomach was so upset. We often use the saying, butterflies in my tummy. That denotes excitement or nervous energy or worry. These examples are the combination of feelings, but also the body's response to stress. In humans, the composition of the intestinal microbiome has been linked to psychiatric conditions such as depression, anxiety, and autism, as well as neurodegenerative disorders, including Parkinson's and Alzheimer's disease. We haven't identified all of these conditions in animals, but microbiome is involved in anxiety and other behavioral concerns. The primary path through which the gut microbiome is thought to affect behavior is bacterial metabolism breakdown products. Some of them can produce neurotransmitters. Neurotransmitters are the brain chemicals that affect mood, behavior, wakefulness, stress, and memory. In dogs, Studies have found that there's a link between gut bacterial populations and memory performance, as well as neurodevelopment. Other studies have found a correlation between bacterial populations and anxiety or aggression in some dogs. These observations are important because they indicate one of three things could be true. One, dogs that show more anxiety or aggression have certain conditions in the gut that influence the composition of the gut microbiome. Or two, the composition of the gut microbiome may influence anxious or aggressive behavior. Or three, dogs that show anxiety or aggression are subject to some alternative condition relative to non-anxious or non-aggressive dogs that also influences the gut microbiome. Identifying which of these is true might provide more treatment options for our pets. Preclinical research in rodents suggests that certain probiotics have antidepressant and anxiolytic activities. Effects of the probiotics may be mediated via the immune system or the neuroendocrine axis. So if probiotics can influence mental health, then there must be some mental health medications that can affect the gut. Inflammatory bowel disease, or IBD, is a group of chronic, relapsing inflammatory disorders of the gut. The true cause of IBD is unknown, but we think that genetic, immune, and environmental factors are all important contributors. Animal models of this disease responded positively to antidepressants like Prozac, so researchers recently studied the effects in humans. When doctors were asked about the use of antidepressants in IBD, some gastroenterologists reported that they commonly treat IBD patients with antidepressants for pain, anxiety and/or depression, and insomnia. These specialists felt that antidepressants were successful in improving several symptoms of IBD. 1/3 of patients also self-reported that they felt there was an improvement in their IBD under the influence of this treatment. This means that products meant to balance the microbiome can help some behavior concerns, and some behavior medication can help reduce the symptoms of some GI diseases. Now that we've discussed the microbiome extensively, we should talk about other GI-related topics that directly relate to behavior. We can allocate these into three general categories: compulsive type behaviors, aggression-related behaviors, and anxiety behaviors. So what are compulsive behaviors? They are defined as ritualistic, repetitive behaviors that are separated from their original trigger and have no obvious function. These behaviors often start as displacement behaviors directed at achieving the ability to cope with a stressful situation. Three examples of compulsive behaviors are excessive licking of surfaces, pica, and fly snapping. Excessive licking of surfaces is actually one of the most common issues that I see, and is usually not the primary presenting complaint. It ends up being an, oh, by the way, he also does this, as we're kind of getting up and leaving the room. Some dogs lick themselves, and this can be related to a dermatologic issue. We'll discuss that later when we get into the skin. Some dogs lick their people, which can be arousal, excitement, or even feelings of being overwhelmed. I don't want you being there. Sometimes we talk about that as the kiss to dismiss, not wanting to interact. This last group is what we're really talking about: dogs that lick the floor, the wall, the bed, the furniture for extended periods of time, where the licking is not reliant on food that was spilled or crumbs or something like that being there. Research shows that 80% of these dogs have an underlying gastrointestinal issue. And once it is addressed, that licking actually resolves. Pica is an obsessive eating of non-food objects like rocks, and socks, and other non-food items. This can also be associated with resource guarding if the dog learns that the pet parent is always trying to take away something that they have stolen, and then they decide that that item is much more valuable because somebody else always wants it, and they start to guard those items. Most causes of pica are actually gastrointestinal upset, including food allergies or nutrient deficiencies. You can see in this middle picture that this dog decided to eat a whole toy and a whole bunch of rocks. And then fly snapping is something that occurs when a dog repeatedly snaps at the air when there's not actually an insect there. This can happen in relation to a hallucinatory seizure in some cases, but in most cases, it's related to gastrointestinal pain. So any type of illness can contribute to irritable aggression. This describes when an individual feels sick and becomes cranky or has a lower threshold to handle stressors. When you, as an example, have the flu and you've got kids running around all over the place screaming, maybe you yell at them to stop instead of gently redirecting them like you would if you didn't have the flu. I want to take a moment to discuss a very unique and interesting example of this. This is one case report, so it doesn't mean that it's common, and it certainly is not the strongest level of evidence out there when we're talking about literature, but it does still provide some important information. So this one case report is where a dog's presenting complaint was aggression, and after a full medical workup, the veterinarian started the dog on a specific hydrolyzed protein diet. After 3 weeks, the aggression resolved. Now, that might sound like anything could have changed during that period. However, 2 weeks after the clinical signs had completely resolved, the dog accidentally ingested the cat's food. He became aggressive on the same day and for 4 more days following that, but progressively returned to normal because his owners limited his access to the cat's food and made sure that he was being fed his diet exclusively. 2 months later, he was so stable that the owner decided to change his diet to another commercially complete food of unknown brand due to episodes of constipation that he was having. After 1 day, the dog started to display aggressive behavior again, and he was returned to his initial diet again and showed progressively decreasing signs of aggression over the next couple of days. So this dog was completely normal per the owner until 2 years before the consultation. And he started to show some signs of progressive aggression initially occurring in relation to meals where he was guarding his food. Then a specialist in animal behavior was consulted, but they all of the changes that they recommended about the dog's feeding routine and so forth didn't lead to any improvement. And then 6 months before presentation, he developed intermittent signs of anxiety and nervousness triggered by noise producing household items like the washing machine and the refrigerator. His owner reported occasional episodes in which he would stare at the walls. The aggressive behavior became more constant and unrelated to meals. And he even started to bite spontaneously, including some of the children in the household. So this is only one case report. And like I said before, not typical or even a common situation, but it does support, especially in this animal, that GI discomfort was dramatically affecting his behavior. In clinical practice, I sometimes see aggression in my patients that are stable, and then an illness occurs. They get into something, eat something that they shouldn't, and they have an upset stomach. They get an ear infection or some other kind of illness, and then they are much more aroused, much more likely to show aggression until that illness is diagnosed and treated. So instead of aggression, some animals are more anxious when they are ill. This relates directly to the gut-brain axis that we spoke about earlier. Research has shown that puppies that are ill during their sensitive period, between 3 and 13 weeks of age, are more likely to develop behavioral problems later in life. So it can be tricky to determine why. We have to think about if it is that the puppy was ill and that the illness caused an emotional dysregulation. Is it because the puppy missed out on their socialization period and therefore they are less likely to be comfortable around strangers or new objects or scary things that happen in the world? Is it that being ill or hospitalized was a traumatic experience itself, and that contributed to some type of fear sensitization? We may never know, but we do know that illness and anxiety do correlate with each other. A large percentage of my patients have some type of anxiety, and many have even tried different medications before they come to see me. During the history taking part of my appointments, I often find an underlying illness that has been contributing to their anxiety. And once we add that treatment of that illness to our protocol, it is easier to control the anxiety. So we are moving from a system within the body that covers almost 15 feet of space to the one that covers the entire outside of the body, the integumentary system. The skin is the largest organ in the body. It provides a barrier to infection and regulates hydration. Skin disorders fall into several main categories: immune-mediated problems, infections, cancers, and allergies. We're going to focus on allergies because they're really the most common. Allergies can be environmental, pollens, molds, insects, and so forth, or food-related. An allergy is when your immune system mounts an overactive response to a certain stimulus. For humans, environmental allergies often cause itchy, watery eyes and sneezy, sniffly noses. In dogs, environmental allergies often cause itching. Itching leads to licking, scratching, and rubbing their body along surfaces, the result of which can be a skin infection because you've irritated the skin. And allergens, like I said before, are the things that cause that allergy. And those include pollens, molds, dust mites, other insects, danders. Some dogs can be allergic to cat dander. Some dogs can be allergic to human dander, which is unfortunate. But all of those things can lead to allergies. So food allergies are something different altogether. And these are reactions to certain nutrients in the diet, and they can cause itching, especially in the ears, rears, and tummy and paws. They also cause loose stools or diarrhea, increased frequency of defecation, extra gassiness, poor weight gain. The most common food allergens that are dietary proteins like chicken, turkey, beef, and lamb. And really that is because historically, those were the most common proteins that were in food. Now, over the last several years, foods contain many different types of proteins. And so we may see that classification of allergens expand a little bit more because dogs are exposed to lots of other different types of proteins as well. The only realistic or reliable diagnostic tool for food allergies is a food trial, a special hydrolyzed diet trial. These hydrolyzed diets are those in which the proteins have been broken down into tiny, tiny microscopic fragments. And that means that the immune system can't recognize them and respond to them. And that way you can eat that food without having an allergic reaction to it. So if allergies cause itchiness, then you can imagine that they may have an effect on behavior. Behavior change that we see are often related to over-grooming or sometimes even aggression. Animals scratch like we do, but they also lick, chew, and nibble their fur body parts. Excessive licking of self can be classified as a compulsive disorder, but research tells us that about 75% of those cases are actually caused by an underlying medical issue, like an allergy. The most common body parts that are itchy for dogs are their paws, and for cats are their bellies. When I see a patient referred for a compulsive grooming problem, I immediately look for skin issues or pain, and most often I can find one that needs to be treated and may not even need to have behavioral medication. So I don't know if any of you have ever had a really bad case of poison ivy or chickenpox or even a drug reaction that related to itching, but it is extremely uncomfortable. Some of these animals turn to really extreme behaviors, including tail chasing, self-mutilation, or even aggression. So tail chasing can be the result of itching, pain, or referred discomfort from the rectal or anal gland area. Self-mutilation can actually be secondary to tail chasing, Sometimes they chase their tail and then catch their tail and proceed to chew it and create wounds along their tail. Aggression is, in this context, classified as irritable aggression, like we spoke about just a few slides ago. And that individual feels so overwhelmed by the itching that they really just have a short fuse. They reach their threshold more easily and they can't take any more stressors. And so they're crankier, more irritable, they lash out because they just don't feel good. Some treatments used for allergies, like antihistamines or steroids, can also contribute to behavior change. Once I've ruled out all possible medical issues and made sure that any skin problems were treated effectively, then I start looking into behavior concerns. And oftentimes, what I'm dealing with is not really a compulsive disorder. So the next system to discuss is the nervous system. The nervous system includes the brain, spinal cord, and all the peripheral or branching nerves all over the body. Problems within the nervous system relate to the miscommunication of signals that travel along these pathways. Neurologic diseases or the treatments for these conditions may affect behavior because we're specifically talking about the brain and the conduction to the brain. Seizures are one of the most common neurologic conditions that I see in my patients. There are many types of seizures, but the typical type is called a grand mal or generalized or tonic-clonic seizure, where an animal collapses with the limbs convulsing in a paddling manner, and the pet is not aware of their surroundings. Sometimes they even urinate or defecate or vomit in addition to some of those convulsive movements. Seizures can have many causes, including genetics, infections, endocrine problems, or even tumors, especially if we're talking about a tumor within the brain. Dogs with seizures should be fully evaluated by their primary care veterinarian or even a neurologist to determine the appropriate course of therapy. Many people, and even some veterinarians, worry that behavior medications will worsen a seizure condition or even cause seizures in a patient. And research has actually shown that seizures can be caused or exacerbated by stress, and that when we are able to reduce that stress with an anti-anxiety or mood stabilizing medication, we can decrease the frequency of seizures. So for my patients that have a seizure disorder, I make sure that they've already been prescribed an anticonvulsant. And then I start behavior medication with the hope of decreasing their stress and helping the anticonvulsant work more effectively. Now, there are some behavioral issues that are manifested in a neurologic way. These are very, very rare, so we won't go into them in big detail. Limbic seizures are those that cause a change in perception. So immediate sadness or joy or aggression. They can have a strange taste or smell perception or a feeling of deja vu in people. We can't really ask our dogs if they feel like they've been there before, but they are really hard to describe in animals. And again, they're very rare. REM sleep disorders are when we are acting out our dreams, even violently. For people, that's walking in your sleep or acting out that dream, talking in your sleep. In dogs, they sometimes seem like they're awake. Their eyes might even be open, but they are not conscious of what they're doing. These dogs will attack their other pet in the house or the humans in the house. They're actually still asleep. They're not aware of what they're doing. So it only happens when that pet is resting or coming out of a sleep period. Narcolepsy is excessive daytime sleepiness, and cataplexy goes along with that condition and that sudden collapse. So in this situation, the cataplexy, the collapsing episodes, are precipitated by periods of excitement. So dogs often will get excited to eat a meal and go towards their bowl, and before they even get there, they'll fall asleep, fall on the ground. And that is important because we have to try to re-regulate some of those neurotransmitters to adjust their sleep-wake cycle and some of the chemicals that say when it's time to sleep and when it's not time to sleep. So one really important other brain-specific condition that is common, especially in older pets, is cognitive dysfunction. This condition is similar to Alzheimer's disease or dementia in humans. We can see some signs as early as 6 years of age in dogs, but most often we don't start to notice more obvious signs until 11 years of age or so, depending on the size or breed of dog and their expected lifespan. And while it does not affect every dog out there, there is not a cure for this condition. So cognitive dysfunction is defined as a progressive neurodegenerative process that can lead to disorientation, decreased social interactions, lapses in house training, difficulty learning, alterations in the sleep-wake cycle, anxiety, and abnormal activity. This is really hard to read, but this is the Canine Dementia Screening Tool. It is the only validated way to diagnose cognitive dysfunction. And by answering a series of questions about how often certain behaviors occur, we can rate that pet and determine how severely affected they might be. So I know it's hard to read. Some example questions on this list are, how often do you find your dog being disoriented in a familiar environment? Or how often does your dog exhibit a reduced response to commands and an ability to learn new tasks? Those kinds of things are on there. And they are recorded as in the checkboxes: never, once in the last 6 months, once per month, 2 to 4 times a month, or several times a week. And then that is graded with a point value and tallied at the end to create that score so we can determine how severely that pet is affected and then determine what our course of treatment should be. So the next section is very important and plays a role in every single one of my behavior assessments. We may repeat some of the information that has been mentioned previously because pain really affects every single body system and is all encompassing. The International Association for the Study of Pain defines it as an unpleasant sensory or emotional experience associated with actual or potential damages, or described in terms of such damage. Pain has an emotional component and is often the symptom of an underlying condition that needs to be identified. It is also subjective and may vary from one individual to the next. Certain people and possibly individual dogs have a lower pain threshold than others. When I take a history, I screen for injuries or other sources of possible pain. I'm especially alert in mature adults that might be suffering for some form of arthritis or something like that starting. Then as I'm talking to the clients, I watch that pet walking around my room. I'm tossing some treats, they're sniffing, they're exploring. I look at their gait, I observe how they sit or change positions, and whether they favor any specific body part, if they're walking in a really stiff way or they sit with their legs out to the side, if something is just off about the way that they're moving. That's important for me to watch out for. So the pain threshold may not just be a superficial determination of grinning and bearing it and kind of making it through that pain episode. Research has actually identified a certain gene that results in red hair and fair skin in people. And that gene makes those people more sensitive to pain, as well as certain anesthetic medications. This gene has also been identified in some red-coated Labrador retrievers. So red coats are just a variation of the yellow coat, but genes that kind of dictate that color also dictate other characteristics in that animal. Because pets cannot tell us what hurts or how badly it does, humans are often unaware that a pet is experiencing pain unless there's a change in their behavior. This study about dog breeds was done to determine if humans, including veterinarians, have a certain bias about which types of dogs are more sensitive to pain or more stoic. At this stage, we don't truly know, but if different breeds do feel differently, we want to find that out. And we do know that certain people think breeds feel pain differently. There's actually a study being done at NC State University that's testing several hundred dog breeds and their individual pain tolerance so that that data can be evaluated for genetic differences. We will know probably in another year or so, once they are able to publish that paper, if there really is any evidence of variation in pain tolerance between different breeds of dogs. So here is an example of how pain may affect behavior. Does pain cause noise phobias? Not really, but it may coincide or contribute. Think about what happens when you're startled suddenly. Most of us flinch, right? We jump. Now consider how you would feel if you had chronic back or neck pain. You would jump from the fear and then be in pain from suddenly moving so fast. And that means that you would become more afraid of being startled in the future because sudden noises or surprises scare you, but they also hurt you. So this study by Lopez Facundes found that there were 10 subjects with underlying pain and 10 control subjects that were non-painful animals. And while most patients present to the behavior service around 1.5 years of age, the subjects that had chronic pain didn't present until a little bit later on, about 6 years of age, for their noise phobias. Noise phobia is more common in dogs with chronic pain. And like we said, it's probably sending those patients over their pain threshold or their stress threshold. The painful patients also generalize their fear to more environments, and that's due to classical conditioning, fear-related avoidance associated with pain. And they had a lower response rate to anxiolytic or anti-anxiety medications until that pain was treated. So that's an important characteristic to recognize, because some of our pets that have storm phobias or noise phobias, especially if they are middle-aged dogs, may actually have some underlying chronic pain or arthritis types of issues that we need to address before we can control that anxiety or fear response. It can be really difficult to identify pain in our companion animals because the signs are really so nonspecific. The Animal Medical Center made this graphic to help us. So for dogs, you can see decreased social interaction, increased sleeping, anxious expressions, reluctance to move, whimpering, groaning, yelping, panting when resting, lameness or limping, not going up or down stairs as much as they used to, lack of interest in food or play, sudden behavior changes like aggression, biting, growling, arched or hunched backs, and excessive chewing or licking of a particular part of the body. The problem is, as you read all of these symptoms, they could mean almost anything. So it's good to monitor for any signs of pain, but we have to determine if there really is underlying pain and what's the cause. So that brings us to some really cool new information that I came along as I was doing some of this research, and it shows how closely pain and behavior are linked. So when people feel rejected or left out, they often describe their feelings with physical pain words, complaining of hurt feelings or broken hearts. Comprehension, so your body's awareness of physical and emotional pain, follow similar pathways. There's a researcher named Naomi Eisenberger, who is a professor of social psychology at UCLA. And she published a study that showed that in humans, especially adolescents that are much more emotional than perhaps the rest of us, physical and social pain pathways are shared. She actually did a functional MRI where she tracked some of those pathways along the brain and showed that there are certain parts of the brain that light up in both situations. So the findings tell us that it hurts to be left out, to be bullied, to be anxious, to be depressed. And we all know that. Kind of unconsciously we think those things, but now we really know that it triggers actual pain pathways when that's happening. It also tells us that individuals that are more sensitive to one kind of pain may be more sensitive to the other, and that increasing or decreasing one type of pain may have a similar effect on the other. These studies have not yet been attempted in animals, But we know that a lot of these pathways are shared between species. So first, a disclaimer about this slide. I am not suggesting that anyone go out and give their pets any pain medication. Even if you think they're painful, you need to consult with your veterinarian first. But that same researcher, Dr. Eisenberger, performed a second study and using, again, these special machines to map out what parts of the brain respond to physical and social pain. Based on her previous findings, the second study was to determine, and again in humans, the second study was to determine whether Tylenol reduced reports of social pain or hurt feelings. They found that indeed, Tylenol, this medication used to relieve physical pain, decreased activity at the specific parts of the brain, which resulted in reducing the pain of social rejection, both neural and behaviorally. The implication is that we certainly need to treat underlying pain, but we may also be able to use analgesic medication to provide relief from fear, anxiety, or depression. Now, again, Tylenol can be toxic to dogs, so do not try to recreate this study at home. All right, so with that thought-provoking information, let's sum up today's lecture. We learned a little bit about how the brain processes information and how the body systems affect that processing. There are still many fascinating connections that we have yet to discover between the mind and the body, but this information shows us how important it is to take a holistic approach to our health and our pets' health. Thanks for spending your Saturday afternoon with me. If there are any questions, I'm happy to address them at this time.
Okay, thank you very much, Dr. Learn. Right now I have one question, which is from, depends how you pronounce it. But anyway, I give my dog probiotics and a fiber water daily. She frequently has soft stool and needs to have her anal glands expressed. Are there better supplements to give her?
Yeah, so that's a good question. And I think that the most important thing for me to start answering these questions with is that because I have not met your specific pet, I can't really provide medical advice. I can give some generalities, but it's always more important for you to check with your veterinarian to make sure that these are the things that would be appropriate for your specific pet. So I think what we first have to figure out is, was your dog having loose stools prior to the probiotic and the fiber, or did that make it better, or did that make it worse? Because sometimes if we add fiber, that can loosen stools and cause loose stools. Sometimes, I know this sounds strange, but sometimes we actually use fiber to firm up stools too. It kind of depends on the type of loose stools or the cause there. The other thing that's important to recognize is that different probiotics have different microorganisms in them. And when you're thinking about supplements like these, it's like comparing them to vitamins, other types of multivitamins that you would get off the shelf. Some are really expensive, some are super on sale and super cheap. And even with that price difference, we don't know what the quality control is between them. So even the least expensive ones might have exactly what is in there and what we need. And the most expensive ones might have more filler or not have the same quality ingredients. So aside from price, what I want you to look for in your probiotics is certain populations of good bacteria. One of the ones that I always look for is Bifidum longum. That's one of my favorite bacterias. It's the one species that a lot of the research has been done on to show that they are creating healthy gut environments. And so looking at your probiotic, you want to know what bacteria are in there, the number. They'll say, you know, how many million live cultures are in there. And so you want to make sure that you have the right type of bacteria and the right amount of those bacteria. Good question.
Okay, here is one. She has a 5-year-old, 5 years ago, a few months in from adopting her fearful dog Moses, a neighbor dog charged at the fence as they walked by. Moses went straight up and landed on his back. From that day on, he became highly leash reactive. Since then, his hind end just gives out when he is taking a turn while running indoors and outside. For example, when he runs out the door into the yard fast, he spills out. He doesn't exhibit pain, he just pops back up. An X-ray taken during a dental showed a mild subluxation of right coxofemoral joint. It will do a hop on that back leg when walking. My vet says as long as he seems okay to just watch him. He is fearful at the vets. She therefore is conservative with him. I feel like he needs more attention and I am not sure what, who, where to turn.
Yeah, you're right. So my same disclaimer is going to be for all of these questions, not knowing your specific dog, right? I haven't put my hands on Moses. I haven't done that exam or checked all those things. And I don't know any other factors of health that are related. But what I'm hearing from the description of that case is two kind of conjoined concerns that I would think about. One is the injury or kind of physical issue, and the other is the emotional issue. And so even if nobody found any mild subluxation of the coxofemoral joint, just the fact that you were minding your own business and a threatening individual charged the fence and scared you so much that you had to flip up in the air and land on your back, that means that was a very traumatic experience, right? And so if we were walking down a dark alley and somebody mugged us, we would probably not go near that dark alley again, or we'd be really suspicious and watchful of any other people that were sneaking up behind us. So that emotional response is really a type of fear sensitization. You had a traumatic experience, it was caused by another dog charging you, and it hurt because you fell down. And so that means that now you're going to be much more reactive and wary and over-aroused about other dogs that are coming near you. And so from a training point of view, we want to help to desensitize that dog or build some more tolerance to other dogs. And there are lots of reactive dog classes and so forth. Those are the tools that you want to focus on. The other half of it is this pain and whether the fall caused an issue with that hip joint or whether that was genetic and it was just exacerbated, or whether that's even the part of the problem or not. We can't really say, but when you have this, so I would even call this hip dysplasia, right? It just means that the ball and socket joint of the hip is not as tight as it should be. And so the femur, the leg bone, is subluxing, is coming out of the socket, the acetabulum, where it's supposed to be tight and live naturally. And so that means that there's going to be bone rubbing inappropriately. And that could even cause irritation and inflammation of the surrounding soft tissue, whether that's just the muscles or even nerves in that area. And so that can be painful. And, thinking about the other description that you said about, sometimes Moses will fall down or the leg will kind of slip out as he's making a turn or something, shows me that he's got some more weakness associated with potentially one side versus the other. And so one option that you have to help would be to see a rehab therapist. So that's like a physical therapist, but made for dogs. Some of them are actually veterinarians, but some of them are veterinary technicians that have gone through special training, and they have, different types of modalities, whether that's wobble boards and Cavaletti bars to walk across, underwater treadmills, all kinds of different things to help strengthen the muscles around that hip joint and rebuild that stability. Some dogs that do have hip dysplasia need surgery. Certainly you would want to think about pain medication if that's warranted. Even if dogs are not limping or lame or showing signs of pain, sometimes there's still pain there. And so when I talked about my patients and assessing them in the room, I look at the gait, I see if they're limping. I also look to see if they're slower to sit, or when they sit, they slide their legs out to the side, or if they have a hard time getting from a sit to a stand or from a sit to a down. And so I want to make sure that they're comfortable and not stiff in all of those transition periods too. So kind of in summary, we want to do some of the training and conditioning to kind of help with some of the emotional fear, anxiety, and arousal that is related to other dogs with some counter conditioning and desensitization. And we also want to work on strengthening the leg muscles around that hip and making sure that we're addressing any pain and potentially reaching out to a rehab therapist to help create some strengthening exercises and core strength.
Okay, and how would you find a rehab therapist, and in particular a vet who is a rehab therapist?
Yeah, so that's also a good question. And some of it is you can look around, and I don't know if all of our audience is here in Virginia area or can be all across the country or all across the world. There is a really great physical therapist in Richmond near me. There is probably a website. Let me just peek on my internet for 1 second, because if I give you the name of my rehab therapist, that's not necessarily going to help everybody. And so I want to see if you can look up the website for specialized technicians and find a rehab therapist near you.
Now, also, would seeing a veterinary behaviorist help, because you would have both sides, the vet and behavior?
So I work very closely with lots of different veterinarians and other fields. And if I do have pain in my patients, I've now analyzed them, worked out what's happening with their mental health, and said, okay, we can work on these things, but also you need to address this pain. I want you to see the surgeon or the neurologist or the rehab therapist. And then we all share notes and work back and forth. And that way we're taking care of this individual from every different avenue. So I think there's a Canine Rehab Institute, but what I'll do is I'll look and see if I can find where you would search, because oftentimes there's a website that you can put in your zip code or something like that and search for a professional near you. And I'll make sure that I get that information back to Deborah, and she can potentially post it on the website. And that way you have access to that. Does that sound okay?
Yeah. Also, what is the website for finding veterinary behaviorists in your area?
Yeah. So that is dacvb.org, not .com, .org. That's the College of Veterinary Behavior. And what you can do is, once you get to the website homepage, it'll say, find a behaviorist near me. And you can just search by either zip code or by state and city. And that's probably the fastest way. If you have a veterinary school in your area, so for us, the closest would be Virginia Tech, NC State, University of Pennsylvania, probably are the three closest. So NC State and University of Pennsylvania both have a behavior department. Virginia Tech does not, but most vet schools do have a behavior department. And so that would be a good way to search as well, if that's closest.
Okay, that's good information. Can rear paw nail chewing indicate pain or just allergy?
That's a good question. So my follow-up question to that would be, is it just the nails? Is it between the toes too? Is it the foot pad or anything like that? If it's just the nails, what I would start thinking about is probably one of three things. I would think that perhaps those nails are too long, and as they're walking, it hurts and it's bending the nails back. And so kind of making sure that they're trimmed appropriately. The other thing that I would think is sometimes dogs will develop actually a yeast infection right at the base of their nails. And that can appear as the skin itself being really red, swollen, and inflamed. But at the very edge of the nail where it meets the skin, you can have kind of all this brownish, blackish, I don't know, like waxy material. And when that happens, that really likely means that there's a yeast infection there. So that can cause irritation and itching and encourage them to be chewing at their toes as well. And if it's in between the toes, then I would say it's more likely an allergy or even the foot pad. Or, possibly they got stung by a bee or stepped on a thorn or something like that, as far as an acute trauma goes.
Okay, this one I'm going to have trouble with because I've never heard the word.
Hydrolyzed.
She has HYDROLOZED, food, need a prescription.
Yes, so hydrolyzed food does need a prescription. Yep. And so that is the way that we are treating or ruling out a food allergy. There are the main brands typically have one. So Purina has a line, and Royal Canin has a line, and Hill's Science Diet has a line of dermatology diets and including a hydrolyzed protein diet. They are veterinary prescription specific, because when you have an actual disease process, you want to make sure you're feeding the right food, the right amount of food, and you're not causing any other health issues. Because we don't know, in addition to a food allergy, if that pet also has a kidney problem or a heart murmur or something else that would be contraindicated. Not that those are, but we want to make sure that we're assessing the whole health of that individual. So yes, the hydrolyzed protein diets require a veterinary prescription.
All right. And do you have any recommendations to reduce inflammation and itching more immediately while testing food allergies?
Oh, right, because it takes a while. So yeah.
Yeah. Let me tell you her situation in case that helps you with your answer. Yep. I am fostering a dog who has a foul odor, itching, and soft stool. I changed his food to test for possible chicken or grain allergy and added probiotics. Stool is firming up and odor somewhat reduced. He is slightly less itchy. He previously was being bathed weekly for a few months, which is not good for this husky. It has only been a week on new food. So do you recommend anything additional, like a topical, to reduce itching more immediately?
Mm-hmm. So I think that there are a lot of things that can happen. When you have a really foul odor, then likely that is either related to the digestive part of a food allergy, if they're gassy, if that's where the odor is coming from, or if it's skin related, then there's going to be a secondary infection, bacterial or yeast or something like that. And so, unfortunately, bathing regularly is part of that. Now, some veterinarians will carry different lines of dermatology products, and some of those are sprays or mousses instead of baths. So that can be helpful, because what you want to do is create a happy environment in the skin and make it a poor environment for bacteria and yeast to thrive in, so that that skin is healthier. I do often use fatty acid, omega fatty acid supplements in my allergy patients, because those are simple to get over the counter, and fish oils are natural anti-inflammatories and help to soothe the skin. If there's a lot of itching, then you would really have to speak with your veterinarian about antihistamines or other things, or if there really is an infection that needs an antibiotic or something like that. But I am glad that you have already started a probiotic. That's a good step forward.
The woman who wrote about Moses she lives in Annapolis, in case that gives you any ideas of anyone whom you know.
Yeah, so Annapolis, so there, the only behaviorist in Maryland's name is Marcia Reich, but she is starting to retire. She's not seeing as many patients, so probably.
Wait, she's not the only one.
In Maryland?
Yeah. What about, there are more. Dr. Ropsky is moving over to Animal Hospital, which is Northwest DC, but it's, but Annapolis is a lot farther. But do you know you don't know any rehab people over that way?
So I don't, but I would say that Friendship. So I know you said Dr. Ropsky is moving to Friendship. They have a really big facility, and I would be surprised if they did not have a rehab spot there. So that would be the first place that I would look.
Yes, it would be a long drive.
Oh, all right. So
yeah, you don't know. You know Virginia.
I know. I'm way down here.
Andressa and Carrie both have put in some links to help find veterinary behaviorists, and I think even I don't know if there's one here also for therapists or not, but okay. And here's another question. My 1.5-year-old Cavachon started to become least reactive to cars, dogs, and sometimes people about 3 to 4 months ago. I don't know, 1.5, wow. I don't know of any trigger outside. In general, he's a picky eater and was never a food-driven dog. I've tried raw, kibble, and now feed him freeze-dried raw with chicken or ground beef mixed in. He occasionally appears to have reflux, but doesn't throw up. I'm wondering if it's possible that the reactivity and reflux might be connected in any way.
So maybe whenever I have a dog that is a picky eater, I always look to see if there's some kind of GI problem, because food is how we survive. And so if you don't like your food, then either the food is really gross, right? You've tried a couple of different brands and types and flavors, so it's not just that, or something about the way that you're digesting or ingesting your food is uncomfortable or doesn't feel good. Some dogs can have liver shunts and things like that and actually feel very strange or ill after they eat food. So there can be a learning component there. I think what I would, the first thing that I always recommend is to have your veterinarian check out that dog and do a full physical exam, make sure that there's no pain abdominally or anything that they can feel that's abnormal, and then do blood work to say everything is functioning normally, the liver, the kidneys, everything like that looks okay. And then you can start looking into sensitive stomach diets and probiotics and things like that to try to balance. There is another blood test that looks at the gastrointestinal system specifically. It screens for small intestinal bacterial overgrowth and deficiencies of cobalamin and pancreatitis and things like that. So your veterinarian could always send a blood panel out to Texas A&M for a GI panel. And that way we can kind of look to see if there is some problem there. Now, it's hard for me to say that that is the cause of reactivity or if it's related to the reactivity. I still think it warrants, fixing and treating. As far as the reactivity goes, even if your dog was not a picky eater or didn't have any of these GI signs, between kind of 8 months and 1.5 to 2 years of age is the most common time that I see dogs present to me at the behavior service because they have something, whether it's reactivity or anxiety or some other disorder. That's the most common time that they present to me. And that's because they've just been struggling with their adolescent period and they're heading into social maturity and they're trying to figure out what's going on, and all of the stuff that they've lived through, genetics, development, socialization period, whatever stuff that they've learned and experiences that they've had kind of come to the surface at that age. And then they are trying to figure out who they want to be when they grow up. And so then they're going to do this thing or they're going to feel this way. And so I don't always see a traumatic event that leads to a behavior change. Sometimes it's very subtle and it happens slowly over time. And then when they reach this age frame, then they start to have more struggles. And that means that you're going to want to avoid those triggers for a period of time, so we're not practicing unwanted behavior, and then work with a good trainer for, with positive reinforcement techniques to say, how can I teach this dog to be more tolerant of some of those other dogs and to regulate their emotions a little bit better, disengage, and relax their brain.
I guess what I'm curious about is a lot of what you talked about aren't things that your typical vet is going to think of or look at.
Mm-hmm.
So do they go to veterinary behaviors to get this combination, or do they, I mean, she can go to her vet and say, hey, could you send this panel to Texas A&M? But where could she have gone where the vet would have thought of that? Does it need to be a veterinary behaviors?
No, some veterinarians do think of those kinds of things. Sometimes it happens in stages. So if you have a problem, we don't want to spend $5,000 of your money straight off the bat, right? The vet is going to start with an exam and some kind of basic things to say, let's see if there's anything obvious going on. And then we're going to try these things, or we're going to try this diet, or we're going to do a food trial, or we're going to do these other things. And then if that's not really helping, or if it helps a little bit but not enough, then we go on to the next stage of things. Because not every dog needs to have a GI panel or to have an internal medicine consult and to have, endoscopy and things like that. So vets are trained to look in stages at your pet's health and kind of figure out what's going on like a detective, right? And sometimes they're easy answers, and sometimes you have to keep working until you figure that out.
Okay. And they could always send you to a larger practice with specialists, which
Sure, absolutely. Yep. Once that is like, this is above me, something strange is happening, I don't know what to do next, then that is the referral to the internal medicine specialist or to somebody else so that they tag in another expert.
The person who wrote earlier about her dog chewing the back paw, she wrote back and said, it's just the nail, and he chews the nails even when she's trimmed them.
Interesting.
Gives you any more information?
Yeah. So, I mean, I think that tells us either that he's not satisfied with how much trimming and he needs more trimming, or that there really is something that is itchy or painful. Is it all four paws or just one paw in particular would be another piece of information to kind of help us figure that out. Because if it's just one paw, then that's more specific for something painful or something irritating the nails on that paw. If it's all four paws, then it may be really an allergy or something itchy, and then looking for that potential yeast infection in the nail beds of those nails.
Okay, another question. Can you please spell the name of the important ingredients or bacteria in a probiotic supplement?
Yes, absolutely. Hang on. What I'll do is I'll put it in the chat, and that way you can have access to it. And what I'll do is, if it's okay with everybody, I'm going to stop sharing my screen so that I can then go into the chat without triggering all kinds of weird stuff, and I can use my internet to look up and spell it correctly for you.
And then I think maybe for people who aren't here, I should copy and paste it into the follow-up, because that's a pretty important question.
Okay, let me just go down here to chat. There you go. Super fancy.
That, you're right. That's the ingredient you're looking for?
Yeah, that's the bacterial species that I look for to see if I want to use that probiotic or not. That's the one I have a lot of research supporting the use of.
Is there a brand that you know?
Oh, yeah, absolutely. Yep, I'll give you a couple of brands. Yep.
Yeah.
Mm-hmm. I'm going to put 3 of my favorite probiotic brands, and then that way you can kind of pick and choose.
Say them out loud so people who only listen to the tape can hear them.
There you go. So Purina Calming Care, and those are come in a little box, and they're sachets. You have one packet of sprinkle that you sprinkle on your food every day. Visbiome is a capsule and Proviable is a capsule.
And you put them in chat.
I did. Oh, hold on. Let me see.
Yeah,
maybe it went to, oh yeah, no, it's my fault. Somehow it clicked onto one member and not everybody. So I'm only going to tell one person. I'm not going to tell everybody else.
Okay,
Sorry.
it's a secret. While you do that, do you think goat's milk is good for probiotics?
Yeah, so that's a good question too, because we have a lot of yogurt and drink goat's milk and, kefir and all of those kinds of things to help our GI systems. Probably 15 to 20 years ago, before we had a lot of probiotics or probiotic information about animals, as a veterinarian, we would say, give your dog some yogurt. They have an upset stomach. Give them some yogurt and that'll balance things out. The problem is that dogs and humans have different bacterial needs and populations. And so yogurt is not really what is the appropriate type of microorganism for a dog. Goat's milk, I don't know, because I don't know what all the microbes are that are living in there. The other dilemma is that some dogs are lactose intolerant. And so there's always a chance that if we give them some type of dairy product, then that causes some upset to the system. And so I think that, we want to make sure that we're picking something that works for that species and also isn't causing any type of upset. If that pet can drink goat's milk and be fine and not have any issue, then that is one, check box marked off. But what I don't know is if it is helpful as far as the probiotic qualities.
Here's someone else who said that her vet said that probiotics are good for dental care.
Because we have a lot of bacteria in our mouth, right? And so it's helping to keep the bad bacteria under control because the good bacteria are there. That makes total sense to me.
And the list that you just put up, someone wants to know if we have tried one on the list and did not see any difference after about 6 weeks, is it advisable to try a different brand or formula of probiotic? Or do you suspect that probiotics are just not going to contribute to wellness?
Yeah, so I think that there are some subtle qualities that probiotics help with. And if we don't see any overt changes, it doesn't mean it hasn't done anything. What it means is it hasn't done enough. And so it might be that you need more or other things to help with that behavior. Because really what we're doing with a probiotic is setting the stage so that there's normal homeostasis. Everything is kind of balanced and healthy. But we also have to make sure that we're finding a way to help that patient with their anxiety or aggression or whatever arousal or problem that they're dealing with so that they can cope better. So adding a probiotic is only part of the plan.
Can you see chat?
I can see chat now.
Okay,
Yep.
Look at the bottom question because I will trip over the word.
Yeah. The goats, is that the goats? Oh, no.
Goat's milk kefir.
Yeah.
It has
bifidobacterium. So good.
Yeah,
so then I would say that's good. And then the next one is L-theanine and Soliquin. Yep. So L-theanine. So this question pertains to other types of supplements that help behavior in some ways. Soliquin is a brand name. One of the ingredients in Soliquin is L-theanine. L-theanine is essentially an amino acid. It is a green tea extract. And the reason that it could be helpful in behavior is because it works actually on some of the neurotransmitters in the brain to rebalance and causes a calming effect that is similar to drugs like Valium without the sedative effects. Now, this is variable from individual to individual and based on how much distress that they are in. So I would never say that a supplement can be more effective than a medication if a medication is warranted. But I think for some of my patients that are more mildly affected, it can be helpful, especially with anxiety. So, mild storm phobias or generalized anxieties, or sometimes even as an adjunct for separation anxiety, that can be something that can be helpful.
You're getting questions. I'm not. You're getting individual ones. So did you see any more?
Let's see. So I only have that one, I think. Let me just scan up and make sure that I didn't miss anything else.
I think we've got the rest as long as I saw them.
Yep, I agree. Oh, hold on. It says one new message. So this is are there supplements or probiotics that should not be used with pharmaceuticals? So the tricky part there is there's no way to kind of think through every single medication and every single supplement that's out there, because there's a chance that something interacts with something else. And so it's always good even to talk to your primary care veterinarian, because sometimes I'll have a patient that gets an ear infection or is on an antibiotic or has something else. And I'm like, oh my goodness, we can't give that with this behavior medication. And so it's hard to answer because there just are so many possibilities. The thing that I can think of off the top of my head is that supplements that have SAMe in them, which are often liver supplements, as kind of antioxidants, can sometimes interfere with serotonin type drugs. And some humans take St. John's wort for memory and calming and things like that. That can also interfere with serotonin affecting drugs. So those are the ones off the top of my head that I would think of as far as incompatibilities, but there aren't many obvious ones. Certainly when you're mixing different types of medications, there's going to be more of a chance for a problem, but not as much when you're talking about supplements and medications.
And there's a spelling question.
Yep. What is the spelling of Soliquin? Yeah. All right. So let me spell that for you.
And say it out loud for the
okay, so that everybody hears us.
Tape.
Yeah. So I'll spell it and say it at the same time. Solliquin. Soliquin. Can you use that in a sentence? I feel like I'm on a spelling bee.
Or Scrabble.
Yeah.
Okay.
All right. And so, with all of those things said, it is important that you are not just listening to this lecture and thinking, oh, I need to go get this supplement, or, oh, I need to go, purchase these things and start giving them to my dog. It's always important to make sure that you're speaking with a veterinarian. It doesn't even have to be a behaviorist. Your primary care veterinarian is going to know many of these things. And so checking and making sure that none of those things are going to interact with each other or are going to cause a harmful effect, not even knowing, the health of that individual pet that you have at home. There could be something underlying that doesn't do well with some medication or some supplement. So you want to make sure that we're choosing the right types of therapy. So don't sneak onto Google and start buying a whole bunch of stuff on Amazon or something like that. We want to make sure that you're getting the right stuff and none of that is harmful to your pet.
That's a very good warning. Okay, I really think that we are finished. Thank you very, very much.
You guys had some really great questions. I loved it. And it's really fun to talk to people who are excited about all of these things and really interested in learning some more. So that's a treat for me. I'm glad. And thank you for everybody that turned out and all of the other people that are going to watch it at a later date. It's a good experience.
And we will see you all next time, hopefully.
Take care. Thank you so much. Bye-bye.